And good evening to all of you. Progress amid the pain. While new grim numbers roll in involving hospitalizations and deaths related to COVID-19, we are now arming ourselves against the virus, albeit slowly. 2 vaccines are now being distributed throughout the U.S. and here in our area. This while Congress is on the verge of passing a new stimulus package. But big advances come with big questions. Hence another coronavirus town hall here with Monroe County Executive Adam Bello and Health Commissioner Dr. Michael Mendoza. Thank you both for joining us once again. We are going to start with Dr. Mendoza. First and foremost, you just received the vaccine, I believe, last week. How are you feeling?
Well, thanks for asking, Adam, and thank you again for hosting us this evening. I am feeling fine, thankfully. I received the vaccine on Wednesday morning. I had some arm pain at the site of the injection there for the next 24 hours or so, but by the next Thursday evening, I was feeling totally normal.
Excellent. And back to Dr. Mendoza real quick. You just heard Maureen talk about this new strain over in the UK, possible new strain. There's a lot of questions about that. Ellen Lippa, a viewer, emailed in wondering what your take was on that and whether we should be blocking off travel from the UK right now.
Well, this is obviously an area of intense interest right now. We are just now learning about this. There's still so much more that we have to learn. This is very reminiscent of where we were this past spring, when we weren't exactly sure if the coronavirus was here in the United States or not. I think my intuition tells me that there's a fair chance that it's already here in the United States. But we are learning a lot more, and one of the questions that has come up is what do we believe in terms of the vaccines that are out and whether they will protect against these new strains. And we are learning a lot more, but the current assumption is that the current vaccines will protect against the strain, but there's a lot more we're trying to learn. At the end of the day, we want to make sure everybody understands that we need to continue with all of our precautions, because until we have that level of herd immunity from the vaccine, these precautions like masking and distancing and so forth are going to be our most important line of defense.
Dr. Mendoza, thank you. We're going to get back to vaccines and treatment and all of that, but I want to get to the other big issue that's coming out today. We've got the stimulus package, and as far as relief for our area, County Executive Adam Bello, I know a lot of municipalities like Monroe County, like our towns and villages, wondering if they're going to get any help in this. What are you seeing so far?
Well, as far as state and local governments are concerned, this is not exactly what we were hoping for in terms of direct aid to state, local, and county governments. But there is still a lot of good things that is in this legislation here that we're looking forward to. One of the challenges that we're facing as a county, and I know a lot of our towns in the city of Rochester are facing as well, is revenue shortfalls, particularly around sales tax revenues, hotel-motel tax revenues, which are impacting the state government as well. And those revenue impacts ultimately could lead to looming state aid cuts, which would really be problematic for county governments in particular, because we are that level of government that provides that service to people who are most negatively impacted by the spread of COVID-19 in the community. So we view this as a good first step. And, but hopefully with the new administration coming in next month, there's opportunities to do more. But in this particular legislation, there is still a lot of good. I'm pleased that there's $82 billion for schools to help support our public school systems throughout the country. There's an increase in SNAP funding that would increase the benefits by 10% to help with food availability to those that are struggling. There's additional dollars for child daycare to help make that more affordable as well. And there was also the enhanced federal unemployment insurance that's going to add $300 a week to those who are unemployed. And my understanding is there's an additional over $300 billion into another round of PPP funding as well. So there's a lot of good support in here, I think, for individuals, for small businesses that I'm particularly concerned about. So this is some much needed relief to people at home. And from what we understand, hopefully they're negotiating another package early next year as well.
Yeah, a follow-up to that, County Executive Bello. Yeah. I've heard from friends who are in the performing arts arena or the restaurant industry. A lot of them are telling me, I got a couple months left before I go belly up here. What is your answer? I'm guessing you're getting a lot of that feedback as well.
Oh, we're getting a lot of that. And that's probably one of my top concerns next to public health and the health of our community is the economic impact on small businesses, particularly restaurants that are being, I think, hardest hit right now because of the restrictions, particularly in the orange zone. And we've done, through Monroe County, our small business grant program that we rolled out in the last month and a half. We've offered PPE to help small businesses, but without additional support from the state and federal governments, this is going to be very difficult, particularly now, too, while we enter into the winter months, where, gathering indoors, you can't really do outdoor dining anymore, so gathering indoors, being very close to people in these tight environments is really not, is something that people are comfortable doing, and also with the reduced capacity, you really can't do it the way we used to. So we do need additional support, particularly I think the PPP loans are a good step. There's also, things that we could do on a local level as well. Just last month, legislation was introduced into the county legislature that would reduce the fee that these third-party delivery companies charge restaurants, particularly small business restaurants here. We're talking about those third-party deliveries like the Grubhubs and the DoorDashes of the world and Uber Eats. They charge restaurants for that service, and it cuts into the profit margins. And I think that, the legislation that was introduced that would reduce the percentage that they charge those restaurants would save restaurants much-needed resources so that they can continue to stay open. And I hope the county legislature raises that from the table and passes that legislation as soon as possible.
County Executive Bello, thank you. When we come back, I'm going to ask Dr. Mendoza who's being vaccinated now and who's next. Stay with us. Welcome back to our Coronavirus Facts First Town Hall. This question going to Dr. Michael Mendoza. Dr. Mendoza, this question is rather simple, at least asking it, but its distribution has been extraordinarily mammoth in scale. Who has been vaccinated so far in our community?
Well, let's just step back and remember that this is probably going to be the most substantial public health undertaking of our generation. At no point really in recent history have we had the responsibility of needing to vaccinate so many people in such a short period of time. And right now we are in the very earliest stages of this vaccine distribution program. The intention of the first week or two was to administer this shot in hospitals and in healthcare settings so that we can manage any unintended consequences that might arise. Thankfully, we have not seen very many of those at all. But for right now, we are administering the shot to healthcare workers who have a higher chance of encountering people who have COVID, who see people with COVID in a healthcare setting, and shortly followed by EMS and other first responders, as well as residents of long-term care and the people who work there. Now, the main limiting factor right now is that we don't have enough lines to get people into to get the shot. And so we're working very hard as we speak to develop more points of dispensing so that we can get more people the shot as efficiently as possible.
And Dr. Mendoza, I'm sure you've seen, like we have out in the community, frustration over how the vaccine is being allocated. Some people saying they should be first in line or trying to move up in line. What's your response to that frustration?
I get it. This is pent-up demand that we've been waiting for months now, and I completely understand, because nobody is intending to devalue the contributions that one person has in terms of our overall healthcare response versus the other. But the reality is that when you have a line and you have limited supply like we have right now, there is going to be a wait, and we will continue to see this as subsequent phases roll out. You know, there are going to be people who are, quote, ahead of you in line, who you might perceive have a lower risk than you, which is why it's so important that we're trying to develop as many points of dispensing in the community as possible so that we can try to shorten that wait for as many people as we possibly can.
Very good. The next question is from Monroe County Executive Adam Bello, and this one comes from a viewer, Carrie, who asks this. With our rates increasing in Monroe County, why don't we have more free rapid COVID testing sites in the suburbs in Monroe County?
So, Carrie, that's a great question. It really simply comes down to the resources that we have. It's a resource issue. So it's about bodies, because it takes an awful lot of people to run these sites to do them well and make sure they're safe. And then it also comes down to how many test kits that we have that have come from New York State for us to be able to put out into the community. So what we did was, understanding we were starting in the orange, we went into some orange zones a few weeks ago. We decided to start there with the orange zones, where we knew there was the greatest concentration of positive cases and where the positivity rate was the highest, and set up rapid testing sites that operate almost every day of the week. So we've built them out. We started with one site and then just kept building and building and building them out. They're open nearly every day. Pre-registration is suggested, but walk-ups are welcome. And we do have some limited numbers that we can do as walk-ups. The teams are doing their very best not to turn anybody away. And then what we've also been able to do as we build that capacity is to work with other groups to try to, when there's a change in the condition that requires rapid testing, for instance, when the barbershops and salon owners were given notice that they could reopen, particularly in the orange zone, but again, they had to have that test before they opened. We opened up a whole new testing site just to get them open and get everybody through. So we'll continue to do that. We're working to do that, but it's really at this point a resource issue, and as much support as we can get, again, from the state and federal governments to continue to expand that, we'll continue to do so.
I want to squeeze in one more question here before we go. So, Dr. Mendoza, this question is for you. It's from Z. Can you address the possible connection between the vaccine and potential allergic reactions? So, again, this question is going to Monroe County Health Commissioner Dr. Michael Mendoza.
So just to step back again, this vaccine has been studied for its short-term effects very, very extensively through very rigorous studies. Even though we've seen a very accelerated timeline for this, none of those short-term effects have been, there have been no steps that were skipped in that entire process. So in terms of the issue of allergic reactions, what we're seeing with this vaccine is the same concern that we see with other vaccines. Anybody who has a history of an allergic reaction to any of the components of this vaccine should think twice before getting the vaccine. The CDC has said it is not an absolute contraindication, but people should be aware and should make sure that they're getting the shot in a location that might be prepared to handle any adverse reactions. But again, to reiterate, no corners have been cut with regard to looking at the short-term safety of this vaccine.
All right, Dr. Mendoza, thank you. So let's say that because of your age or your occupation, you're next in line to get the vaccine. How will you be notified? We're going to ask that very question to County Executive Bello when we come back. Our Coronavirus Facts First Town Hall continues now. The next question is going to Monroe County Executive Adam Bello. Mr. Bello, this question is from Marie, who asks, how will those of us who have health issues and are over the age of 75 be notified when it is our turn to receive the vaccine? And I'm going to expand upon that. How will any of us know when our group comes up?
Right, so that's a really great question. And so as we talk about a lot, and you see on TV, the vaccine right now, because it's in limited supply, is being distributed in phases. The first phases were healthcare workers, long-term care facility workers and residents, first responders, then come next teachers, and so it's going down into categories and phases. The governor has designated local hubs across the state. There's 10 hubs, including here in the Finger Lakes area, here in Monroe County. It's a Strong Memorial Hospital. And the hub his responsibility is to try to build out each one of those phases in the distribution model. So certainly what the goal is for each one of those is, particularly when we get down to the general public, people over a certain age bracket, things like that, is to work with your primary care physician and go through the same process you would normally go through to get a vaccine through your doctor so that we don't really have to go back through and reinvent the wheel. But I don't want to guarantee that quite yet because those phases are still being built out, and of course it all depends on the quantity of the vaccine that comes in and when it comes in. But we wouldn't want to see this all get reinvented from scratch, and my expectation would be you'd work with your primary care physician when we get to that stage.
Very good, Mr. Bello. Thank you. Next question is for Monroe County Health Commissioner Dr. Michael Mendoza. Dr. Mendoza, a viewer emailed us in the newsroom today reminding us that before we were talking about the vaccine, all the talk was about treatment. My question is, how has that been going so far? Are the treatments what you had hoped for? And if so, how's the supply and the equipment and all that?
Well, as this pandemic has rolled forward, we have seen so many potential treatments come and go. But at the end of the day, what we're seeing locally is that we're doing a much better job treating people who end up getting COVID-19. We know that because the length of stay in the hospital is shorter. We know that because we are identifying people who have COVID-19 earlier in their course of illness. We're able to prevent many people from even needing to go to the hospital. So, we're doing a better job overall. But the reality is, it's not perfect, and we know this because we are losing far too many people to COVID-19 here in Monroe County every day. So we still want to emphasize prevention, but I will say that we will continue to follow the science, and as new treatments come on board, we'll evaluate them as rigorously as possible. Some of the monoclonal antibody treatments here, for example, were studied in trials at our local hospitals, and turns out the evidence isn't great for their use, and so neither of our hospitals is using this. But we will continue to follow the science, and as emerging treatments come out, we'll evaluate them rigorously.
So no silver bullet at this point once someone is infected and their symptoms worsen?
No, we do know that steroids and remdesivir and antiviral treatment have probably shown the most promise, but there is no silver bullet on this one, unfortunately.
Dr. Mendoza, thank you. On a related note, I want to talk about our hospitals in the area. So, County Executive Adam Bello, this question is for you. What does capacity look like in our hospitals? And I'm asking this, it's kind of a two-parter because we might move into a red zone if capacity reaches a certain level, according to Governor Cuomo.
That's correct. And right now, we have about 30% of the capacity is still remaining in our hospital systems. And a red zone is defined as your hospital capacity reaching 90% full, which means you only have 10% left, within a 3-week period of time. So you do your projections out, and if you're projected to hit 90%, that's when it would trigger a red zone. Right now we're at 70%. So how the systems have been handling this, and we talk to them on a daily basis, is they load balance within their systems. And they do so by looking inside the hospital to ensure that as the COVID positive admissions start to increase, that what they do is they then pull back on the elective surgeries and other types of admissions so that it balances out, so that that capacity still remains and they still have that ability to surge if necessary. So even though the percentage of COVID positive patients that are in the hospital right now continues to go up as a percentage of all those hospitalized, that's why you still have not seen a real stark increase in the number in the number of people hospitalized, because they've been pulling back in the other areas. So they've been able to balance that inside. Now that's not that's a good situation to be in today, because they're managing that capacity. It's not overwhelming the hospitals yet, but that's not a real good long-term solution to this if the numbers continue to go up, because what will happen is those elective surgeries, it sounds like the term makes it sound like it's something that's unnecessary, but it's necessary. It is necessary to the people who are waiting to receive those procedures. They're just not procedures that are needed today. They're not emergencies, but they are quality of life procedures and medical procedures that are deemed necessary, that are getting pushed off into the future. So that's why we as a community, even though we're not seeing that 90% full yet, and we're really not on track to see that in the coming weeks, we still have to come together and understand that there is still a strain on the healthcare system. There's a strain on patients in the community and on our healthcare workers, and we all have to work together to flatten the curve to support those in the hospital systems, because they're the ones that are treating our families, not just for COVID, but for all the other ailments that are afflicting us as well.
Mr. Bello, thank you. And flattening that curve has a lot to do with Christmas. And Dr. Mendoza has a message about that in just a moment. We are going to get right back into it now with our coronavirus town hall here at News 8. This question is for Dr. Mendoza. Christmas is almost upon us. A lot of people want to see their relatives, especially if they haven't seen them in a long time. What are your contact tracers telling you when it comes to the primary source of spread in our community, knowing that we're going into this holiday?
Well, this is such an important question because as we look ahead to the weeks to come, everybody wants to gather as much as they feel they can. But the challenge, of course, is that we know even now that the vast majority of viral transmissions have been occurring in private gatherings, such as those in your living room or family room or in your private homes. One thing that we have learned, though, since Thanksgiving is that travel has introduced a wrinkle, so to speak, into how people think about their risk. And the reality is that a lot of people are trying to do the right thing in their home, trying to keep their gatherings small. But when they introduce an individual who's traveled into our area from another part of the state or another part of the country, you have to think a little bit more carefully about the risks that that person might be introducing into your home. And so the notion of trying to keep distance within a home, to keep your masks on even if you are in your home with your family, a person who's coming in from outside is not part of your household from the standpoint of COVID-19. And so what I would encourage people to do is to think about those travelers, people coming into their home, potentially staying in their home, and trying to keep distance whenever possible, or even consider having a loved one stay in a local hotel or motel just for that initial period so that we can follow them and make sure that the coast is clear.
Dr. Mendoza, thank you. The next question is from Monroe County Executive Adam Bello, and it has to do with evictions. The last few days, we've seen this issue highlighted here locally, and yes, we do have an evictions moratorium here in New York State, but that doesn't mean you can't be evicted. In certain circumstances, you can. So my question to you, Mr. Bello, is what resources are out there for anyone, I guess, who might be struggling at this time and might be forced to leave their home?
Yeah, there are just far too many people in our community right now who are struggling with reliable, safe, affordable housing right now. And particularly at this time of the year, it's hitting hardest. And there are some support mechanisms in place that we've invested in to help families who are struggling, either those who are facing eviction right now or have fallen behind on rent payments and are concerned about when we come out of this pandemic what would happen. If you right now are facing a financial hardship in relation to paying your rent, if you call 211, the county has put CARES Act dollars that we receive from the federal government into a program that can help pay so many months of your back rent through the CARES Act program. But we also have emergency assistance programs and things of that nature that could be available to help you be able to stay in your home. So I would encourage you to call 211 or our COVID hotline at 753-5555, and the folks there at both of those numbers can help connect you to the support system and the mechanism that could help you stay in your home.
Mr. Bello, thank you. A two-part question now for Dr. Mendoza. The first part is, if you get the vaccine, does that mean that you can't spread the virus? And then a follow-up question to that is, are there any conditions that would prevent or should prevent someone from getting the vaccine at this point?
So we know that the way COVID-19 is transmitted is from person to person. And getting the vaccine doesn't actually change that fact. If you're within 6 feet, particularly if for a longer period of time and not wearing a mask, you could still transmit the virus from one person to the next. What we do know about the virus is that it has been studied and shown to be 95% effective at reducing COVID-19 related pneumonia and COVID-19 related mortality. So that doesn't mean that you are necessarily immune from transmitting the virus to somebody else. It just means that if you've been vaccinated, you're much less likely to get sick or to have a death resulting from it. So it's very, very important for people to remember that just because you get the vaccine does not give you license to take off your mask and to forget about all the precautions that we've been talking about. Now, with regard to prior conditions that might put somebody at risk for this vaccine, it turns out there are exceedingly few. Those who have immunocompromised or chronic medical conditions, it turns out, would stand to benefit greatly from getting the vaccine. And so none of those conditions has been listed as a contraindication to getting this vaccine. So at the end of the day, if you've got questions, and we know many people do, we want you to reach out to your healthcare provider, But right now, the only absolute contraindication really is a prior history of severe allergic reaction to a component of this vaccine.
Dr. Mendoza, thank you. You heard Dr. Mendoza just a few minutes ago talk about travel. Well, I'm going to ask Mr. Bello when we come back, what happens when the vaccine is available to you and you might be out of state? That's coming up. We're going to restart our Coronavirus Facts First Town Hall with a question from Chip, and this is for County Executive Bello. Chip asks this: I am a resident of New York State, but will be snowbirding in Arizona from January to April. If the vaccine becomes available during that time period, do I have to return to New York to receive it, or will I be able to get it in Arizona? Very specific question, but I thought I'd ask it all the same.
Sure, no problem. It's so it's a complicated question, as they all are, in terms of receiving the vaccine right now to answer before we know when those quantities will be here. But this is the advice I'd offer you, is that if you are going to regularly spend 3, 4, 5, 6 months of the year out of state or out of town living someplace else, you really should have a healthcare provider where it is that you're living. You should have a relationship with another primary care physician, health provider, so that you could have these conversations with them, so that when a vaccine is available, it can be available to you wherever you are, but also if you face any other health issues, that you don't have to come back home to see your doctor. You have a relationship with a healthcare professional where you are.
Mr. Bello, thank you. The next question is for Dr. Mendoza. This comes from Susan G., and she's asking if she receives the COVID vaccine, both Pfizer and Moderna, correct me if I'm wrong, they're two-parters. You get one, wait a while, and then you get the other. If you get, say, the Pfizer, and then a month later you go to get your booster or your second shot, can you get Moderna at that point? Can they be crisscrossed, or is this only work when you have Pfizer to Pfizer?
So the current guidance is that you are supposed to take the same product that you got for your first dose. So if your first dose was Pfizer, your second dose should be 21 days later, should be Pfizer. If your first dose was Moderna, it should be 28 days later, also Moderna.
And a quick follow-up to that, those who have had COVID-19 and they have antibodies, is that the same as getting the vaccine?
No, it turns out that getting the vaccine is very different from natural infection in terms of the protection that you might get from either one. Turns out we don't really have a very good sense of the duration or the strength of the immunity that results from natural infection. And many believe that that duration and strength is actually a lot less than we would like it to be. And so it's for that reason that we're encouraging anybody who has had either symptomatic or asymptomatic COVID infection in the past still goes ahead and gets the vaccine.
Very good, Dr. Mendoza, thank you. County Executive Bello, I want to talk about schools. We've seen some school districts in our area go virtual because they've had incidents in the schools. So my question to you is, how safe are the schools right now, and what advice do you have for them?
So we still believe that schools are probably one of the safest places that you could be right now, and that's due to a lot of hard work, and I give a lot of credit to our school administrators, our teachers, and our students and families who are working through all the guidelines to keep people healthy and safe. But just because schools are a safe place to be doesn't mean that individuals who go to school aren't getting sick. When we talk about schools being safe, we're talking about that there's really no evidence of the virus spreading inside the school buildings, but teachers, students, administrators can still get sick outside of school. And so it's really important, that's why particularly over the holiday break week that we're about to have, that we want to keep people safe so that when they come back to school on the other side of the break, the schools can stay open. One of the hardest factors that plays into keeping schools open right now isn't, again, the spread inside, but it's actually with the adults. It's keeping the teachers healthy. It's keeping the administrators healthy. It's keeping bus drivers and other support staff healthy so that the schools can stay open. So that's really the goal as we get through this holiday week. And when you see schools starting to struggle, it's because, you know, there's really not the availability of substitute teachers that there used to be and things like that. So we really need to keep the adults healthy, work together to do that, to keep those schools open, because I'm a parent myself, and I want to be able to keep my kids in school just like all of you do as well. But to do that, we have to get the community numbers to be lower as well.
And the testing so far going fairly well?
Testing is going very well in the schools. They have really risen to the occasion. The schools in the orange zones are continuing to test. Again, that's why we know how safe it is, because one of the things that was right about opening the schools in the orange zone was that it still required 20% testing a month of the teachers and students who are in person, but it required it to also be done on a weekly basis, so that on a weekly basis you have a sense within all the school buildings in each of the districts of exactly what's happening inside the buildings. You get that community surveillance look to make sure that the virus still isn't spreading, catching cases before it can spread, and that we know the schools are continuing to be a safe place to be. And I'll tell you this, you know, you say, why are the schools safe? It's because they're following the guidelines. They're following the guidance. If we all followed that same guidance that they are following to a T inside those school buildings, we would all be safe out here in the community as well, and we could lower the spread. And what they're doing is they're masking, physical distance, and they're washing their hands.
All right. Mr. Bello, thank you. When we come back, more of your questions answered right here on our Coronavirus Facts First Town Hall. Stay with us. Welcome back to our Coronavirus Facts First Town Hall. This question is for Dr. Mendoza. Dr. Mendoza, I get a lot of questions about nursing homes. People obviously concerned about COVID-19, but also concerned about the well-being of those isolated, if you will, in those nursing homes, not being able to see family. What are the potential medical drawbacks of that?
Well, you know, words can't express how difficult it is for families who are living with having a loved one in a nursing home, not being able to see them, not being able to interact with them now for a number of holidays. You know, that is just something that nobody would have ever anticipated becoming an issue here with this crisis. But the reality is that it is very real. And while we encourage families to do everything they possibly can, nothing will substitute for that face-to-face, in-person direct contact. Now, the reality is that we also know that nursing homes are among the highest risk places in our community, with upwards of 75% of the mortality to date occurring either in a nursing home or in an assisted living. So we have to balance the risk, and unfortunately there is a lot of variation even among residents of nursing homes about how much risk they're willing to take. And so the challenge, of course, is you've got different sides of the campus, if you will, trying to figure out how to balance that risk without putting anybody at risk. It turns out is a very, very great challenge for everybody involved.
Yeah. Dr. Mendoza, thank you. The next question is for County Executive Bello, and this question is from Kathy. When 65 to 74-year-olds can get the vaccine, what type of facility is expected to be used for this? Are we going to have to stand in line in a crowded facility?
No, I certainly hope not, because that also wouldn't be a safe condition to be in with the spread of the virus here. This is what I'm hoping for, and certainly the goal would be by the time we have more general distribution of the vaccine, particularly as we head into age brackets in the community, that you'd be able to work with your primary care physician as you would other vaccines that you receive, to be able to work with them to receive it through them. That would be the goal, obviously, but then as you get out further and further into the general community, you know, there's also the potential that the pod system could be utilized as well. What that looks like, we're still a little too early to tell whether that's a drive-through scenario or something else, but this is the one thing that the county does have a plan for when it comes to a pandemic. Everyone says, well, there's really no rule book for a lot of this. One piece that we do have is the pod system that can be utilized to do a mass distribution of the vaccine. The challenge in making that determination today is that we just don't know yet what quantities of the vaccine we'll get and when. So we don't know how big of a distribution will be at any one given point of time. So the hub system and the hub, our regional hub, will be working on that over the next several weeks and months ahead. And again, I do urge you, as you get through, once you get out of one of those designations like a first responder or a teacher and we're into the general community, to work with your healthcare provider to get information about how to receive the vaccine.
Mr. Bello, thank you. Dr. Mendoza, this question is for you. The viewer wanted to remain anonymous, but it aligns with some of my questions as well. We see the numbers come in every day, number of new cases, number of deaths. How is that calculated? Because some days you see 0 deaths and then the next day 27, and then the numbers can swing wildly as far as cases go by 100, 150.
Well, the cases are much more predictable in that on any given day, the cases that we report are all of the cases that came in before midnight the night before. So for today, on Monday, we reported today all of the cases that came in yesterday, Sunday, up until midnight. And we spend the entirety of today verifying all the data, making sure these are residents of Monroe County, and just generally making sure that the data are accurate. When it comes to hospitalizations, those data don't come into us in a very predictable fashion. Those come in from the hospitals at different times of the day. We have multiple hospitals in our system, and so that number is a little bit more variable. And when it comes to deaths, that is probably the most difficult to predict, because we learn about deaths from hospitals relatively quickly. But when we have out-of-hospital deaths, sometimes we won't hear about them at all until they come through our Office of Vital Records, which can take days, if not even weeks. And so we try to report the data as quickly as possible, but we want to make sure that we're reporting them accurately. And so sometimes it will look like the numbers swing wildly from day to day, but at the end of the day, what we want to do is make sure that they're accurate and correct.
Dr. Mendoza, because you're on camera right now, 45 seconds, any last message before folks head into this holiday break?
I would simply thank the community. We have been through a very tough 2020, and we are in many ways in the home stretch. We've got to look ahead to the next months to come. We have to make sure that we don't let go of the reins. We've got to make sure we continue to take all of our precautions, But for the next several months, I think our most important lesson is to learn about this vaccine, to answer all of the questions that we may have. Many people have very valid reasons to have concerns, and we want you to have those concerns clarified, whether it's through the health department, through your health care provider, or through many of the community forums that we're going to be planning in the weeks and months to come.
Dr. Mendoza, thank you, and thank you for being here, and thank you to County Executive Adam Bello as well for your insight in answering our viewers' questions. For all of the latest information on COVID-19, both in our area and beyond, just log on to our website, rochesterfirst.com. Thank you for watching. News 8 at 6 is coming up next. Stay with us.